Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop posterior tibia tendonitis pain. But before I do that, I will go over the symptoms, the causes, the risk factors, and basic anatomy, and then we'll go over the steps that you can take at home to stop your tendonitis pain. So when you look in this model, this is the outside of your leg and your foot, and the tibia is in here. This is the bone that's attached all the way to your knee, and the posterior tibials is attached in the back underneath your knee and all the way, and goes down to the inside of your leg and attach here to the navicular. So when you start to experience pain, usually the pain occur in this area. The symptoms is swelling, redness, swelling especially in the outside of your ankle, pain with weight bearing, tender to touch, and when you start to palpate it, you might experience or noticing some knot or scarring on this area here. So as you can see in the first image in here, the red tissue here, that's actually the posterior tibial, and it's attached all the way from here. Your knee is all the way in the top here, and then going down all the way to the inside of your ankle. And when we look at the ankle from the inside, when you have posterior tibia tendonitis, you will experience inflammation, swelling, and you see here that's a scarring on those areas, and that's usually the location of the pain of the posterior tibial tendonitis. One of the important things that we need to realize the causes and risk factors, because if we eliminate the cause and risk factors and work on the problem, usually that is the solution for it, instead of masking the symptoms or continue having the trigger that caused the tendonitis pain. One of the issue is bad shoes. If you wear high heel or non-supportive shoes, that could increase your risk factor for this issue. The other issue is pronated foot. You can see the image in the middle. That's a neutral foot, which means it's aligned very well. If you have pronated foot, your arch is collapsing. Instead of have normal arch, your arch is collapsing, and this is the way it looks from the back when your arch collapsing, and that's actually very high risk factor for posterior tibial tendonitis, because when you your arch collapsing like this, it's actually overstretch and stress the posterior tibial muscle and actually put some pressure on the tendon and cause micro tear in the tendon and tendonitis. The other anatomy for the foot with the excessive supination, but that's not relative to this issue. It's most likely pronated foot is a risk factors. Also, if you have injury to this area, that might cause a tendonitis. If you are a woman over 40 years old, that's another risk factor. Obese, diabetic, or if you have high blood pressure. The other thing also, if you experience ankle sprain, that might cause tendonitis in the posterior tibial area. So how to treat posterior tibial tendonitis pain? Before I go over what you can do to treat the pain, we need to understand normal healing cycle, because it will make a lot of sense, the treatment, when we understand what is the issue going on internally. So I'm gonna use external paper cut for visualization, but the same process happened with tendonitis, but we don't see it because the skin cover it. So the first stage of healing is inflammation, swelling, redness to that area, and you start to experience pain and decreased range of motion. And actually, by definition, tendonitis is inflammation in the tendon, and you can see it here in the tendon area. You start to have swelling, the redness, and actually you start to have scar tissue, which is actually the second stage of healing. So during the proliferation stage, the body starts to build a scar tissue, fascial restrictions, muscle spasm, and trigger points. And you can see it here. If your body does not build the scar tissue, it's open wound susceptible for infection. So actually, we need a scar tissue. Scar tissue is part of our survival. The problem is when we have excessive scar tissue that's in middle of everything and cause restrictive range of motion, swelling, and pain. That's what happened with the posterior tibial tendonitis. Perfect scenario during the maturation stage, your body should get rid of everything in the proliferation stage and inflammation stage. That could take days, weeks, months, or years. If you have a chronic condition, you're probably going back and forth between the inflammation stage and the proliferation stage, and that's very classic for posterior tibial tendonitis. To visualize what's look like internally when you have normal muscle tissue, it's look like nice and smooth like this. When you start to have a micro tear in the muscle or a tendon, you start to have random tearing like this. Your body has to build the scar tissue to heal. But the problem is the scar tissue usually build up randomly like that. The more scar tissue you will have and your body does not resolve it, that scar tissue in the way of everything, because our muscle should act like a rubber band when contract and relax. It should stretch like a band. But when you have a scar tissue, it's like you have a knot in the rubber band and your muscle will not be able to stretch enough. And that's very classic with the tendonitis. So what should we do to treat posterior tibial tendonitis pain? Before I go over the treatment, I'm gonna go over some of the common treatment that's not effective, so you don't have to waste your time on it. And we're gonna relate that to the studies that's done on it and also related to the normal healing cycle. So one of the common things that have been used is ice and steam and heat, and based on the studies, they are providing temporary pain relief. But when we look at the normal healing cycle, it's not gonna do much to the inflammation and proliferation. It's basically masking the symptoms. The other thing that's been used is massage and foam roller. Think about this way: you have open wound, inflamed area. If you continue rubbing it, you're gonna inflame it more. So the foam roller and massage could make it worse. But the problem is, based on the studies, massage and foam roller is either provide temporary pain relief or no pain relief. And when I go over the fascia system, it will make a lot of sense why massage and foam roller will not work, because mechanically impossible with the knuckle, with the hand, or the foam roller to go deep in the tissue to do deep release. And if you cannot exert mechanical force on the scar tissue, the fascia restrictions, it's impossible to release it. You not be able to treat it. So the other thing that's been used is stretching, and I personally do not recommend the stretches because there's more harm from stretching than benefit. Think about this way: you have a micro tear in the muscle that should act like a rubber band. If you overstretch it, that micro tear gonna tear it more. And based on the studies, stretching is actually cause more inflammation. And if you start to have more inflammation, that will cause more scar tissue, and that will increase the chance of having that vicious cycle get worse. There are other alternative safe options than stretching that we can utilize without the side effect of stretching that I will go over in this video. Other thing that commonly use joint mobilization, but based on the studies, it provide either temporary pain relief or no pain relief. And when we look at the normal healing cycle, moving the joint will not gonna do much to the proliferation stage. It might actually cause more inflammation if we overdo it. So it's irrelevant to treat the tendonitis. The other thing that's commonly used is strengthening exercises. The problem is if you introduce in the wrong time. If you have inflammation and you do a lot of strength exercises, that will inflame it more. But more effective than strengthening exercises are the function training. That's why I do function training instead of the strengthening exercise during the right time of healing, so we're not causing more inflammation. So what should we do to treat the root cause of the problem? So first thing, we have to break the vicious cycle of inflammation and proliferation. So for the inflammation, if you have a minor case of tendonitis, rest 5 days to a week. That should be good enough to really get it back to normal. But if you have chronic condition that has severe inflammation and proliferation, your body going back and forth between those two stages, and we have to be aggressive to break that vicious cycle. What I personally use for inflammation, I use a MagnaHeal 2 to decrease inflammation. This is very strong magnetic field device that actually the magnetic range around 3 inches, so it can penetrate deep to decrease the inflammation in the patella, posterior patella tendonitis, and also if you have inflammation in the posterior tibial muscle itself, that can go deep enough to release it. So the other thing I like to do with all of my patients, put them on the anti-inflammatory diet, because there are certain food that actually cause internal inflammation, slow down the healing process. And for chronic condition that has, like the patient that has diabetic or high blood pressure or other health issue, there's a high chance that you have vitamins and mineral deficiency. One of the things that you can do if you have severe condition, take advantage of Ask ASTR. It's a free online medical evaluation. The software takes about 5 minutes and will help you and guide you through the process of possible vitamins and mineral deficiency that could be interfering with your normal healing. So while we're working on inflammation, we have to break the proliferation stage: scar tissue, fascia restrictions, muscle spasm, and trigger point. As we see here in this image, there is a lot of inflammation with the tendonitis, and also there is a scarring here, and there is a fascia restriction. So for I personally use the A3 to break the scar tissue, the superficial scar tissue. And for deep scar tissue, I use the A5 to go deep enough to break deep scar tissue. That's why I said foam roller and massage not effective, because it's impossible to go deep enough with the knuckle or the foam roller to do deep tissue release. We have to have a mechanical force on that adhesion area to do the release. Briefly, I'm going to go over the fascia system because it's overlooked by a lot of healthcare providers and has significant effect on posterior tibial tendonitis. So the fascia system, as you can see, is the white tissue here. Those are the fascia layer. And when you buy a meat next time, look at the white filament, and that's actually the fascia layers. So we have a superficial fascia layer that's wrapping the entire body, very thin layer wrapping the entire body, and you have deep layer that divided to 4 subcategories of fascia layers that wrapping a group of muscle, each individual muscle fiber and each individual fiber. I just want to show you the complexity of this system because it has significant effect on tendonitis, but don't worry, the treatment is very simple. So the fascia layer divided to 2 main categories, superficial and deep layer. And the deep layer is actually divided to 4 subcategories. You can see here the deep layer divided to apparatus fascia, epimysin, premiysin, and endomysin. To make things more complex, each of those layers have 2 to 3 sub-layers that on the top of each other. So when we look at the fascia system, you will see here the epimysin that's wrapping each individual muscle fiber here, and then the premiysin wrapping a group of muscle fiber, and each individual muscle fiber wrapped with the endomysin. And that's why I said it's impossible with massage and foam roller to release those layers, because when you start to have adhesion and scarring, those layers are stuck together. And if you cannot apply mechanical force on those layers, it's impossible to release it. It's like you have a motor that you want to unscrew a screw in the motor, and the screwdriver you have is very short. It's impossible mechanically to actually unscrew that screw because you don't have that length to really go deep to do the function that you want it to do. That's why what I personally use, I use the A1 to release the superficial fascia layer, the apparatus fascia layer, and I use the A5 to release the epimysin, premiysin, and endomysin. And I personally can go deep 2 inches, 2.5 inches in the posterior tibial muscle to release it. Because when you have tendonitis here in this area, your issue is not only in here, your issue is here because the whole muscle is tight, and it's very common you will have in the gastric muscle, that in the top of the posterior tibia muscle, and also the posterior tibial muscle has a lot of scarring in this area. When you start to palpate with your hand, you will notice there is a knot or rock feeling in there, and that's a deep scarring, and we need to release it with A5 to really loosen up this muscle, because if we don't release it, the posterior tibia muscle lost a lot of range of motion. It doesn't matter how much work you're gonna do in here, if we don't release the whole muscle, it's not gonna be full recovery. So to sum it up, how to treat posterior tibial tendonitis: we need to break the vicious cycle of inflammation and proliferation. If you have a minor case of tendonitis, 5 days to a week of rest should be enough to get you back to normal. But if you have chronic condition, you have severe inflammation, severe proliferation stage issue, you probably want to break that vicious cycle from both ends. While we are doing that, we need to correct your foot posture. If you have severe pronated foot, we need to correct that. Sometimes we can correct it with the exercises. I have videos on that, and sometimes you need to wear orthotic for that. The other thing, we have to work on wearing the proper footwear. So I will avoid any high heel, and you will need to wear a supportive shoes. And then you need to walk properly. If you have abnormal gait, that's a risk factor for having tendonitis in your posterior tibia. So we need to correct your gait. I prefer to do function training like gait training instead of doing strength exercises for ankle pump or for your knee or ankle, which not really transition into your function, to really correct the way you walk in. Because if you still continue walking funny, which actually cause a risk factor for the tendonitis, that will not get to the root cause of the problem. So we have to work on all of that simultaneously to get to the root cause of the problem and eliminate it. If you have any question, leave it in the comment section below and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.